Did you know that more than half of all cancers strike people over the age of 60? That statistic alone might send a chill down your spine. But here's the real kicker. Many of these cancers go unnoticed until they've already spread. Detection can mean the difference between a simple treatment and a fight for your life. So today, I'm going to walk you through 8 sneaky symptoms you should never ignore if you're over 60, and then share 3 everyday foods backed by science that can help lower your risk. Stick with me until the end. Imagine waking up in the dead of night, your pajamas and sheets soaked through, even though your room is cool and you barely have covers on. You shrug it off as stress, maybe blame that extra cup of coffee or the spicy dinner you had. But then it happens again and again until you find yourself changing pajamas and stripping the bed every few nights. Unexplained, drenching night sweats, especially when they come without any fever or illness, can be one of the earliest warnings of blood cancers like lymphoma or leukemia. It's not just a hot flash. It's your body releasing inflammatory chemicals that confuse your temperature controls. If you find yourself waking up soaked more than once or twice a week, and no fan or lighter covers seem to help, make an appointment with your doctor. A simple blood test or imaging scan could uncover what's happening inside before it turns serious. Now picture sitting down for breakfast and taking a bite of toast. Normally, swallowing is effortless, but if you feel a burning sensation that lingers long after you swallow, or if food seems to stick in your throat, that so-called heartburn could be more than indigestion, persistent acid reflux, heartburn that wakes you up at night, forces you to take antacids daily, or makes swallowing difficult, can lead to chronic inflammation of the esophagus. Over time, this inflammation may evolve into Barrett's esophagus, a condition that significantly raises the risk of esophageal cancer. Many seniors assume it's just part of getting older, or a reaction to a heavy meal. But if you've tried changing your diet, lost a few pounds, and still can't shake that burning, insist on an endoscopy. This quick camera test can spot abnormal tissue changes before they turn into something much worse. Have you ever glanced down after using the bathroom and thought, that doesn't look right? Most people don't want to talk about stool, but changes here can be critical. Pale clay-coloured stools might signal a bile duct blockage from a pancreatic or liver tumour. Dark tarry stools can mean bleeding in the upper digestive tract, and if your stools become consistently narrow, like pencils or ribbons, it could indicate a mass pressing on your colon. Accompanying bloating, a sense of incomplete evacuation, or sudden diarrhea or constipation lasting more than a few weeks, are red flags. Don't dismiss these changes as just diet or stress. Your stool is one of the first places your body shows internal problems. Talk to your doctor about simple stool tests or imaging studies that can catch issues early when treatment is most effective. Your skin can send messages too. As we age, dryness, thinning, and bruising more easily are normal. But new or changing patches of skin deserve attention. If you notice areas becoming rough, discoloured, or irritated without a clear cause, it could be an early sign of skin cancer, or even internal cancers affecting your immune system. Persistent itching in one spot that doesn't respond to creams. Red patches that look like eczema, or a yellow tint around the neck and armpits could indicate liver issues. There's also a rare condition called acanthosis nigricans, where skin folds become dark, thick and velvety. This sometimes points to gastric cancer or insulin resistance. And if bruises appear without trauma, or cuts take unusually long to heal, blood-related cancers like leukemia might be at play. Keep an eye on skin changes, especially in areas not exposed to the sun, and consider a skin biopsy or blood tests if something seems off. Eye discomfort or vision changes rarely make us think of cancer, yet they can be critical clues. Persistent eye pain, sudden blurry vision in one eye, flashes of light, or floaters that don't go away could mean ocular melanoma, or cancers that have spread from the breast, lung, or other organs. Unlike normal age-related shifts, these symptoms worsen over weeks and don't improve with new glasses. You might feel a dull ache behind the eye, or pressure that feels like a sinus headache. In some cases, double vision or difficulty seeing at night appears. An eye specialist can use ultrasound or retinal scans to look deeper inside your eye. Don't assume any new vision trouble is just aging. Get it checked promptly. Bone pain or deep joint aches can also be warning signs. A nagging backache, hip pain, or unexplained shoulder soreness that lingers for weeks and doesn't improve with rest or over-the-counter painkillers could indicate bone metastasis or a tumor pressing on nerves. Cancer-related pain often intensifies at night and feels different from arthritis. It's more of a deep, gnawing ache or sharp twinge, even when you're resting. If you've been nursing the same sore spot and it's getting worse instead of better, talk to your doctor about imaging tests. X-rays, MRIs, and PET scans can reveal hidden tumors before they spread further or weaken bones. Take a closer look at your nails. It might seem odd, but your nails can tell a story about your health. Clubbing, where fingertips swell and nails curve downward, can develop when blood oxygen levels drop, often seen in lung or gastrointestinal cancers. Dark vertical streaks on a single nail might signal subungual melanoma, a rare but serious form of skin cancer under the nail. Brittle nails, pits, or grooves that weren't there before can also hint at internal issues. These changes often come without pain, so they're easy to miss. If you notice any sudden nail changes, especially on just one finger, get it checked out. Have you ever had a day where you just felt off and couldn't put your finger on why? That vague sense of unwellness, feeling more tired than usual, foggy-headed, or like everyday tasks require extra effort, can be one of the sneakiest signs of early cancer. Some people also experience mild fevers, chills, or a persistent sore throat that won't clear up. These symptoms happen because cancer cells release chemicals that alter immune and neurological functions. If you've been feeling unwell in a way that's hard to explain, and it lasts for weeks, don't ignore it. A broad panel of blood tests and imaging scans may feel like overkill, but they can uncover hidden cancers long before more dramatic symptoms appear. Another subtle clue is eye pain or changes in vision. Yes, it bears repeating because it's so easily overlooked. But persistent discomfort, pressure behind the eye, or sudden floaters can be your body's way of signaling trouble. Routine eye exams may not catch these issues, so insist on a thorough check if symptoms persist. By now, you've heard about persistent night sweats, stubborn heartburn, Worrying stool changes, skin shifts, eye troubles, bone aches, nail alterations, and that nagging sense of unwellness. These 8 signs aren't meant to scare you, but to empower you. If you're over 60 and notice any of these issues lasting more than a couple of weeks, reach out to your healthcare provider. Early detection can boost survival rates from around 20% in late-stage cancers to over 80% when caught early. Before we finish, let's talk about what you can do right now to lower your risk. First, fill half your plate with broccoli, cauliflower, or Brussels sprouts. These cruciferous vegetables contain sulforaphane, a compound shown to protect cells from DNA damage and reduce inflammation. In one large study, people who ate just 1 serving of cruciferous veggies daily had about a 30% lower risk of aggressive cancers. Steam them lightly for 3 minutes to preserve the nutrients. Then add a sprinkle of lemon or a dash of garlic for flavor. Next, make tomatoes a regular part of your diet, whether fresh, roasted, or in a homemade sauce. Tomatoes are rich in lycopene, a powerful antioxidant linked to lower risks of prostate and lung cancers. Cooking tomatoes actually makes lycopene more available to your body, so don't be afraid of that homemade marinara. Just skip the sugary jarred sauces. You can roast cherry tomatoes with olive oil and herbs, blend fresh tomatoes into a smoothie, or add sliced tomatoes to your morning eggs. Finally, snack on berries, blueberries, raspberries, strawberries, and blackberries. These tiny fruits pack a punch with anthocyanins, ellagic acid, and vitamin C, all of which help neutralize free radicals and reduce inflammation. Animal studies showed a diet rich in berries cut esophageal tumors by nearly 60%, and human research confirms lower markers of oxidative stress in regular berry eaters. Add berries to oatmeal, blend them into yogurt, or simply enjoy a handful as a sweet snack. Cancer doesn't always shout. It often whispers through these subtle signs. By paying attention to your body and adding broccoli, tomatoes, and berries to your meals, you're giving yourself a powerful advantage. If something feels off, even in a small way, don't brush it off. Check it out. Let me know in the comments which of these 8 signs surprised you the most, and tell me which of the 3 foods you're already enjoying or plan to add to your diet. Thanks for watching, and remember to like this video and subscribe so you won't miss any of our future health tips. Stay vigilant, stay healthy, and take charge of your well-being, because catching cancer early can save your life.